Welcome to the Living Medicine podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show.
Well, hello, everybody. I am Dr. Sandy Newis, and I'm with the Living Medicine Institute, which is a business that provides content, training, and resources for clinical and medical providers who are specifically interested in learning about ketamine-assisted psychotherapy, as well as general skills in psychedelic medicine. And I'm really excited to have Dr. Jonathan Leake here on the show. Jonathan is a physician, and he is one of the people who has transitioned from being an emergency room doc to actually starting a ketamine clinic. And a little bit more specifically, Jonathan left the ER, transitioned out of the ER. I just talked to him, and he still is doing some of that work. And started a series of hydration clinics in the Charlotte, North Carolina area, and really got involved in helping people in that way, and then began to get interested in mental health applications. So providing ketamine infusions, as well as NAD and some other types of support for mental health. And then we actually met him because he came to Living Medicine Institute training and began to also offer CAP. So some people may not be aware that most clinics don't really do both, but it's our understanding that at Dérive, which again is in the Charlotte area, that you all are doing both, where you provide it both internally, and then you also have outpatient therapists come in and bring their clients to you. And so anything else that you'd like to add about the bio there?
Yeah, no, I think that's a great summary. You know, I also completed the CIIS training certificate in psychedelic therapy and research. So we really dove in deep here.
Good. Well, I love that. So, like I said, you're definitely one of the pioneers in the area, that one of the few clinics that do both ketamine and ketamine-assisted psychotherapy. And I honestly just recently became aware of how rare that is in talking to other people in different parts of the region. Because, at concierge medicine and psychiatry, where I still see clients, we do that. And I'm aware of you do that. So, one of the pathways to providing ketamine and CAP is on the physician side. So we talked to lots of therapists, but, you kind of come in from the physician side. And so tell us how you got here. Kind of, what's your professional path, and
Sure.
how does that work for ER docs? And I'll ask you in a minute kind of what you need to do that. So we'll get more into the nitty-gritty of it. But what about personally too? Like what's your draw to this, working in these non-ordinary states and working with this
Sure.
person?
Yeah. So, I think this story is a little bit funny in that I was a psychology major in undergraduate and
Mhm.
became really, super into particularly neuropsychology and like, hey, how does the brain and all these things that are happening inside our head, make our thoughts, feelings, emotions, and those sort of things. And so I actually went to medical school to become a psychiatrist. I was,
Mm.
completely hooked on psychology and psychiatry, and really had a lot of debate between going and getting a doctorate in psychology and going the medical route, and decided to go
Oh,
the medical route.
interesting. I didn't
Yeah,
know that. I had the same debate actually.
yeah. And so it's
I'm not so sure I
and
made the
it's
right
tough, right?
choice,
It's
but
which way to go. So, but got drawn into medicine, and I think particularly I was so kind of hooked on the science side, decided to go that route. But
Mm.
once I got into medical school, I kind of found that there were a lot of frustrations in psychiatry. A lot of the medicines came with horrible side effects, or had, it caused even more problems for people sometimes. But really, there was just this lifelong suffering. We really saw depression and PTSD as, chronic lifelong conditions that we tried to kind of mitigate symptoms and manage symptoms. And I didn't see the kind of, healing that I wanted to see happening. And so I ended up kind of putting psychiatry to the side and going to a place where you could kind of dive in and fix problems and make rapid changes. And that was emergency medicine for me. And
Uh-huh.
so it was a big shift, but, finding the emergency department, I just loved the diversity of what we saw, and being able to kind of act on things, quickly and make quick differences in people's lives. And so ended up going on to become an emergency medicine physician. So that was medical school, and then 3 years of residency here in Charlotte to become a ER doc. And, certainly as an ER doc, I continue to be really interested in neuropsychology and neurology and how that all works. But what we see in psychiatry and emergency department is, certainly frustrating and difficult. We see people when they're really, really sick and have very limited resources to help them. And so I think, psychiatry continue to be kind of a hard thing to really practice from the emergency department.
Well, I imagine so, and one of the things I know about ER docs is that it's kind of, fast paced and ever changing. So,
Right. Yeah. Keeps us
yeah.
on our toes.
So what about that kind of pressure with the mental health? I mean, that is something I hear repeatedly from physicians that, is really hard, especially in the ER where you're trying to treat people with, the resources that you have under high stress, high pressure conditions. And, we're increasingly aware of, prevalence of PTSD and chronic stress among providers in those situations. And
Yeah.
just curious what your thoughts are about that.
I think it's tough. I think practicing in the emergency department, mental health and mental health emergencies are extremely challenging for us because one, we don't necessarily have the training and resources to provide that care. Two, we're in a really, really busy place, where maybe you have someone having a heart attack next door. And so you're trying to think about how to care for both these patients. And then kind of three, there's just really limited resources. And so people often spend days to weeks in the emergency department with, essentially zero psychiatric care for their psychiatric emergency, waiting to be placed and cared for. So, it's really tough. And I think it really is going to require a systems approach, to how do we, help these people better, right? And probably
Right.
the ER isn't necessarily the right place, for them. But then, does this kind of also summarize like what we're faced with as providers, that this kind of moral injury of not being able to provide the care that you feel like someone needs or not be able to help someone that they need in a way that they need. And the little chunks that takes out of us as healthcare providers, right, over time, I think adds up as well,
Right. And no support for ER docs.
Right.
I mean, right? Nobody's like helping you process what you've seen or witnessed or experienced or the effect on your nervous system.
Yeah. No, there was I was actually had gone back, was watching some Scrubs episodes recently, great show. And there was one, where they talk about, this doctor being in the room with a family telling them that their loved one is dying or about to die. And, they're like, no one in that room is going back to work except for the physician, and the physician is immediately going on to see more patients and care for more people. And so it's, and I think there's not as much training around that as there probably should be of how do we hold that space for physicians and providers and nurses and, help support them through those things. Right.
Well, and even acknowledging that it's a thing.
Right.
Right. Like, oh, here you go. Like, here's somebody like, struggling with a heart attack, may or may not, live. Here's somebody with a psychiatric emergency. Here's, some kind of accident coming in and, here's some mandates from administration. And then you have to go home and be like, hi, how's the dog? How's the kid? How was your day? Like, oh, you need me to vacuum? Like, oh, okay, I'll vacuum.
Right.
Right.
Yeah.
It's just a lot. So,
yeah.
So how did you make that leap? Like, here you are like working as an ER physician with, tons and tons of training and background. And here you are in the ER. And, now here you are running
Right.
clinics and, ketamine infusion clinics. So how'd you get from here to there? Like what was the impetus and, yeah.
Yeah. So, basically my business partner, Keith Paris, and myself had worked together in the emergency department and we'd worked together for several years. And we started, looking at obviously taking care of people when they were sick and run down. And so the overall thought that we had was, how can we help people live healthier lives? How can we help people live healthier so they're not getting to the point they're showing up in the ER?
Yeah.
And so kind of our first solution to that was these hydration clinics, and really kind of opening Hydrate Medical. We opened that in 2014 with kind of this concept of helping boost people's health and wellness. And so what we did is we wanted it to be this beautiful space where people could go and relax and receive vitamin infusions and kind of focus on how do we, help them just kind of boost their overall body's wellness so that they could feel better overall. And so we opened our first clinic there, was really that focus and, found that it went really well. People were getting better. And, it's kind of funny. I know now that I think the set and setting of Hydrate Medical is really important too, that it was this beautiful place that people could take a little time out of their day and come and relax. And so, we continued that work. And then around 2016, 2017, I started seeing this research really coming out about ketamine and ketamine infusions and for mental health. And so that came together in that, we had a clinic where we could do IV things.
Mm.
And, I felt very comfortable with ketamine. I use it almost daily in my practice in the emergency department for sedation. So I kind of knew the medicine and knew the
Yeah.
safety and efficacy of it from that side. And
Can
so,
we put like a little bookmark on
yeah,
that? Like
yeah,
we've heard, it might even have been you. We've heard in our trainings, ER docs say like, we use this in the ER like water, like
absolutely.
an
Yeah,
incredibly safe medicine. So I just always
yeah,
wanting to highlight that for people that the adverse effects often come from psychological um,
absolutely.
influences and or oversweeping claims about what ketamine can and can't do, but not really physiological.
Yeah, no, I think 100%. We get to see the safety data every day in the emergency department. We're using much higher doses on very medically ill patients and seeing how
Right.
well they do. Right.
Right. Yeah. Yeah.
Absolutely.
So, okay. So are you saying that you were following the research and suddenly you're like, oh, wait a minute, we could actually do this at Hydrate?
Yeah. So, the research was coming out and I kind of dove into it. I was said, this looks interesting, but let's see what the science says. And so,
Yeah.
being the kind of neuropsychologist that I was on the side, I kind of dove into it and was like, man, I really like how this is working. We're seeing that it's actually changing the brain, the way that the brain works, and we're seeing kind of amazing results. Anytime in medicine that you see 70 or 80% of people responding to a treatment, first you have to be a little bit suspicious, like, hey, is this real? But then when you're seeing this repeated in multiple studies and those numbers coming out over and over again, it's like super exciting. We're like, man, this is cool to see, a medicine that's actually working like this. And so we decided to kind of put it together and design a protocol, and bring it into Hydrate Medical and start doing some ketamine infusions there. Yeah, and so it was an amazing transition to kind of jump in and be part of that, and to see kind of the practice develop from there.
Okay. Well, and so, what do you think, having been through it? You went through CIIS, you've been through Living
Mhm.
Medicine Institute, you've continued your study. Like, if somebody, is a physician or medical provider or even a therapist, because you've, been witnessing that pathway too, like, what's the pathway? What do
Yeah.
you recommend? What's the most important thing for people to know?
So I think it's hard as a medical provider. It's easy to jump into the literature on ketamine and kind of say, okay, what are people doing? What works? And
Yeah.
then think you're going to bring it into your practice. And unfortunately, ketamine research is very, very clinical. It's like, hey, we give people 6 infusions at zero point 0.5 mg per kg, and 70% of people will get better. And, they might need occasional other infusions. But there's really nothing about what does that actually look like, right? I mean, is someone
Right.
just coming in and laying on the floor and we're giving them ketamine, or are they like sitting in a chair? Are they in a doctor's office? What did they do while they got ketamine?
Hmm.
And so that kind of came up for us, I think, naturally when we started this at Hydrate, and then, kind of rolled it into Dérive, was seeing, oh, the more we support people, the more we prepare them for what their experience, the better the room is set up for, kind of introducing this comfort, the better they do. And so, I kind of quickly saw that as we started practicing with ketamine. And it
Yeah.
led me to kind of dive into all this other training. Like, hey, let's go, dive into psychedelic therapy and training and bring some of that into the treatment. Let's go have experiential training at Living Medicine and, kind of see what this actually feels like and how to incorporate that into our process. And
So you, like a lot of people get into the field are like, I mean, even though it's not legal, people are like, oh, I had my own psychedelic experiences,
Mhm.
and, that like changed things for me and I wanted to pursue. But it sounds to me like you were very literally following the science,
Yeah,
following the research, following the science, and also following the business.
right.
Like, you're a
Yeah,
businessman and you work independently. So I can respect and appreciate that. Most of the people who, want to do this work are as well.
right. Yeah, and I think that that's a focus. From in Hydrate, we were really super client focused already.
Yeah.
And so we were very much looking at that experience for our clients already. Hey, what made this experience better for you? What made it worse for you? What was distracting? And I think we were tuned in from that, both from a provider standpoint and from a business standpoint of like, hey, what makes our client have the best experience? And naturally, we were finding that the more we supported them, the more we cared for them, the better the room was set up, the better they did. And that kind of drew us into the psychedelic kind of research by accident, because it was just kind of like, well, I hear they're working with other psychedelics. What are they doing in those studies? And in those studies, it's all about
Yeah.
set and setting and exactly what they're doing for the clients to support them and prepare them. I mean, the more that we brought into the practice, the more we found, or the better we found people were doing, which was just super cool and exciting.
Well, and for people who don't know, let's just kind of take a little sidebar and talk about the differences in different types of ketamine clinics? Because, my impression, and you would know this even better than I do, because again, you're kind of, surveying the business side of that, which is that, in some infusion clinics, it can be just like kind of set up almost like nail salons. People are like scheduled at
Mm.
15-minute intervals. And, sometimes there's a television there. Do you all have televisions in your
Oh,
Okay,
no.
because I always tell people, I'm like, if they tell you that you can watch Netflix, like
Right.
that's not a good clinic, because
Yeah.
ketamine is not like visual,
No. Yeah. Not in that way, right? Yeah.
Right. And it can be kind of, set up, get people through, get people moving, versus like, your clinic, because I've been at some of the sites,
Mm.
and, the clinic that I work at, where it's all about, that setting people and attending to the client and making sure that they feel comfortable and they feel safe and that we have a relationship. Can you speak
Yeah.
to the importance of that?
Yeah. I
What
mean,
you're witnessing, even just in the field versus what you all are doing, and we're
yeah,
not trying to throw anybody under the bus, rather just
sure.
really, hit this piece about the importance of the care part.
Hmm. Yeah, there's this huge divide, that this is more than just ketamine infusions or ketamine shots, that it's really ketamine plus care, and I think that that's where this field needs to go, is that we have to understand that we're doing something that is very deep and very transformative for people. And
Mm.
so it's a huge responsibility that comes with that, of like, this isn't just ketamine, it's ketamine therapy, or it's ketamine plus care. And so I think you have this range of clinics that are just kind of bringing people in. Maybe there's a group room, and not in a really great psychedelic, therapy designed group room, but just a room of chairs where people are staring at each other and getting ketamine infusions. And there's not really any support or preparation for the experience.
They're
Um,
just like hanging out, like in a
right.
circle, kind of staring at each other.
Yeah.
Oh, that's
Without,
so weird.
right. And very weird. And they're strangers. There's no like focus on the group or, group
Right.
dynamic of that.
Right.
I've heard stories of that said, where it's like, oh yeah, what do you want to watch on Netflix today while you're getting your ketamine infusion?
Right, exactly. Or the
Yeah.
news is on.
Right. Yeah.
Like, how
Yeah.
about that? Here you
Right.
go. We'll just have a little like news go
Yeah.
while you're doing this.
And so maybe it dives a little bit into like, what is really like ketamine therapy all about? And I think that some of the early literature, and hopefully this is starting to change, but was really seeing the psychedelic experience with ketamine as a side effect. And it was
Right.
like, hey, yes, ketamine, it causes neuroplasticity and works on glutamate receptors. That's great. And unfortunately, it might make people have this little psychedelic experience too. And
By the way,
we wish that didn't happen, but it does. Sorry.
that
But
kind
if
of
you put
weirds
on
people
Netflix, they
out.
do fine. Right. And you even have some clinics that are adding, really powerful, dangerous sedative medications to infusions to avoid the psychedelic experience. So maybe they're adding other anesthetics to try to put people asleep, so they're not having that psychedelic experience. But we found the more you lean into it, the more you support people, that it's actually this huge healing part of the process. And now maybe actually people have long-term effects and long-term gains because of the psychedelic experience and the support around that.
Right. How do you differentiate? This becomes relevant again because you're doing both, right? You're
Mhm.
doing you're doing the infusions and you're doing the therapeutic side. So how do you
Right.
differentiate um, care from CAP? Like you're
Right.
saying ketamine care, which I appreciate the care with which that word is chosen, because
Yeah.
it's broad. Um,
Right.
versus, one of the things that we're kind of standing for is like, let's get clear on a definition of what CAP is. Ketamine
Right.
assisted psychotherapy, and ketamine treatment and ketamine therapy are often used interchangeably. So,
Right.
when we kind of go into this piece about ketamine, the care associated with it versus ketamine assisted psychotherapy, like, can
Mhm.
you speak to that? Like, what you're seeing, how you do it in your clinic, what you see as the differences there.
Yeah. I think there's almost this continuum, right? There's like all the way on one side is like just ketamine treatment or, ketamine infusion. And all the way on the other side is like CAP. Okay.
Yeah.
Right. And so, and ketamine care plus care, or ketamine therapy, as we describe it, I think kind of falls somewhere in the middle of that.
Yeah.
And, I think that really ketamine alone, or just ketamine treatment, it carries a lot of risk with it in a like psychological way. I think
Mm.
because no matter how you frame this or do this treatment, you're going to end up getting this psychedelic experience and this psychedelic, opening that's going to come up. And so what kind of container are we holding people, with in that, so, if you just go into an infusion place, you're put into some small room, you're given, Netflix is turned on, you're given ketamine. all this psychedelic stuff's happening, all this mind opening is going to happen no matter what. And so how do we hold that for that person and make sure that the right things are done? And even if we look at it from a neuroplasticity standpoint, like, hey, we've turned on this switch in the brain to rewire. And so how do we hold and put the right things in so the brain is rewiring in a way that we want it to?
Right.
You
One
know?
of the people that I, really follow and admire, who I interviewed a while ago, Dr. Ron Siegel, he does mindfulness teaching, and he will talk
Mm-hmm.
about optimizing the conditions in your life that allow for you to remain or stay more deeply in a mindful
Mm-hmm.
state. And that's
Yeah.
kind of what I'm hearing there. Like, how can we optimize the conditions that people are going to get the positive benefits of this neuroplasticity?
Right.
Is that
Yeah.
accurate? Is that
I
what you're
think
saying?
so. Yeah. And I think that the, studies and our experiences, and we've talked about this, and I think you guys agree, like the more we surround people with that care and that therapy and those parts to this, the better they do long term, the more likely
Yeah.
they are to have transformative change, where this is something that you're talking to someone about 2 years ago and they're saying, yeah, I still feel really, really good and still have some amazing tools from that experience, rather than just kind of focusing on just the medicinal side of like, yeah, you got some ketamine to change some things in your brain and maybe you feel better for a little bit. But it's harder to have permanent change without kind of looking at the therapy side, I think.
Well, and this is interesting because, like, just bear with me for a second. I'm just kind of thinking about how, like, good, like, spa clinics have sort of, figured this out too, right? Like, you go into like a nice spa and they give you the bathrobe. It has the particular smell of the spa products, right? There's this like kind of thing that kind of is conducive to that. And I feel like a
Right.
lot of ketamine clinics aren't doing that.
Mm-hmm.
It's like bright lights and you sit there and
Right.
you're like laying on a hospital bed or just like sitting
Yeah.
there in a room, like you said. So, and again, we'll get into the CAP piece, right?
Mm-hmm.
Because I'm hearing you saying we're specifically focusing on just the ketamine treatment alone without
Right.
a therapist. But
Yeah.
what if you were going to give advice to medical
Mm-hmm.
providers who are, and this isn't even the pathway training, we can talk about that too. But like if you want to
Right.
open a clinic where you are focusing on that patient care piece that you believe is going to maximize the likelihood they're going to have a positive, lasting outcome, what do people need to do?
Yeah, so I actually get this call a lot. I'll get ER doctors calling me up and, oh, it looks, I like what you're doing and I'd like to give ketamine too. And how should I do that? And so, what they're looking for is they want to hear like, well, where do I get ketamine? And, what's an infusion? And do I need a pump? And, what's the dosing? Like they're looking for this really technical side, right? And I always start with I start from the other side of like, hey, what's actually really, really important that you have to learn? And it's going to be tough because you're an emergency medicine doctor and you have to learn this side is what does the container look like that you're doing this treatment in? And what is the set and setting, and how are you really holding this space for people and realizing that you're being part of a transformative journey for this person, whether you realize that or not.
Yeah.
And so you have to at least be able to hold that space for them, and how deep you want to go into the therapy side of it, how much you want to learn that and try to move towards CAP. It's kind of up to you, but you have to understand that at the very least, you need to be doing ketamine care or ketamine therapy, which is, holding that space for that person and making sure that you're safely navigating through ketamine therapy with them.
Do they know what that means? Like when you say like holding that space for them is a very, very common term in the psychedelic
Right.
world. And
Yeah.
you're talking to like ER docs and people who are not in that world, or maybe, are interested in that world, but not really familiar. Does that particular phrase have a lot of meaning?
I don't think initially, and it's something that I end up, diving into with them of, what that does mean. What some things that providers know and are good at that, I do talk about is that we know about building rapport.
Yeah.
And we know that building rapport is maybe one of the most important things in psychedelic therapy.
Yeah.
And I think you guys talk about that a lot in your training.
Oh, yeah.
And so what's cool is that some of the people that are coming to this, like emergency medicine doctors and anesthesiologists, one of the things we share is that we have to be good at building rapport very fast because I walk in, I meet you, you're very, very sick. I quickly have to get you to trust me and think that you know me in some way, right? So you can trust and open up. And I think anesthesiologists have the same way. Hey, I'm Dr. So-and-so. I'm about to put you to sleep. I got to get you to kind of know me and trust me a little bit in a few
Yeah,
minutes.
2 minutes. Oh, wait.
Yeah. And then the other is that, we're trained on how to kind of control the energy in the room a little bit. One of my
Mm,
main roles in the ER is I have to be able to walk into a trauma room that is like chaotic and everybody's running around, and I have to quickly kind of bring the energy down and kind of settle that room so that we can move forward on a common goal.
Yeah.
And so I talk to people about those basic tools, like, hey, here's 2 tools that you have that are going to be really, really awesome in this work if you use them well.
Oh,
And
brilliant.
it helps to kind of frame some of those initial conversations of that you're going to sit and have an hour at least conversation with the client about their history, where they come from and who they are, and then tell them about who you are and who this place is, so that their nervous system can start to settle into the place, and you can start to, build that connection so they can trust you and open up and have a deeper experience. And then you're going to have to, support them through what might be challenging experiences during the infusion. And the more you can do that, the better they're going to do.
We talk about kind of a, clear but soft authority. Like, I think it's so
Yeah.
important to like
Yeah.
step into the like, we got this without being
Right.
like overbearing
Yeah.
or
Yeah.
dismissive and like, well, we got this, you don't need to attend, but rather that like caring, like you would in an ER. We got,
Yeah.
we're
Yeah.
here. You're in
I
good.
love that. And that statement of like, we've got you, right? Like, I've got
Mhm.
you.
Yeah.
You're in amazing hands here. We are extremely experienced in ketamine. We're extremely experienced in emergency medicine as a team. So we're going to take beautiful, wonderful care of your body and be able to support you through this process and this journey. And it's just, we're seeing as people can lean into that, you can watch them kind of, melt into the chase in our first conversation and see as their anxiety starts to wash away, they start to kind of settle in. And now guess what? They're opened up for a deeper experience. They're able to kind of go inside more and kind of trust the ketamine experience a little bit more and get more out of it, right?
Yeah. So I'm hearing step into authority, show them that we've got you, manage the energy of the room, right? Attend
Yeah.
to the variables that will help somebody feel safe, which you didn't say it exactly like this, but I'm hearing relationship, be able to
Mhm.
build rapport and
Right.
prioritize that. Like, we know in the therapeutic world that, it's a well-established, fact. I don't know what the most current data is, but it was like 40+% of clinical outcomes are associated with the ratings of the therapeutic relation.
Yeah.
I can only
Yeah.
imagine that it's the same in a medical setting, and that data
Right.
is probably out there.
Absolutely, yeah. And that's, this whole placebo effect, right? I mean, that we see that, it probably a lot of it is not necessarily placebo, but it's that 30 or 40% of the response is due to the clinical care, of like
Yeah.
kind of being able to hold this space and show that you care about someone and that side of it.
Well, and you also said meet with them for at least an hour, going over
Yeah.
history. So there's some assessment skills, some interview skills, because I
Mhm.
think that's actually a place that a lot of physicians don't really do. Like, why do I
Yeah.
need a whole psychosocial history when we know that this is medically safe and there's no medical contraindication? So let's have at it.
Yeah, and I really see that part. I'm building all those like facts, the little checks that I need, for my list. But I do it in a very conversational way because I'm building the relationship at that time. And so it's really, I start off with, hey, welcome to Dérive, and we're going to sit here for the next hour. And first, I want to hear all about you and your story and how you got to be sitting here in front of me today. And then I'm going to tell you a lot of details about who we are and what this process is going to look like, and we're really kind of going to go through the details. Um,
This is the cat that
Hi,
I was.
Kitty. Welcome.
Sorry.
No,
Right.
that's great.
So, yeah. So, and then, what I'm hearing in there is kind of the secondary piece too about, how do you conduct it and what questions do you have? And this is where we get into scope of practice, what's important, and I think people are pretty individualized on that depending on their background. Um, but also just, what I find so critical is, I want the person to feel known,
Mm-hmm.
like they feel like we get them at least
Right.
some basic level. And of course, that's a professional skill set. Like, do you really get somebody
Mm-hmm.
after an hour? Well, if you ask the right questions and,
Right.
focus on developing rapport and are really intentional with that, like, sure,
Yeah.
to a certain
And
degree.
I think, people aren't used to having that interaction with a physician, and I get that feedback a lot of, it's really interesting, I think, for a client to sit with us and have a physician, or a nurse practitioner kind of say, hey, tell me about you. And I'm going to just sit here without watching my clock or,
Right.
really on some really tight time scale and just hear your story. And I'm
Yeah.
actually amazed at how well people do of like summarizing their story into 15 or 30 minutes in these sessions. There's probably been less than a handful of people in the 7 years that we've been doing this where I'm really starting to have to kind of reorganize them or pull them back in.
Right.
But most people do a really good job of kind of summing up. And I think they just appreciate being heard of kind of, they have amazingly complex stories before you end up at ketamine therapy, right? It's not that I felt bad for a few days.
Well, most people, let's face it, I mean, most people, it is expensive. It's a big
Right.
investment.
Right.
Most people, this isn't their first stop on the mental
Mhm.
health train.
Mhm.
Like they've been through it, right? So
Absolutely.
they're
Yeah.
looking for something different. So, well, okay. So kindness, care, build rapport with intention.
Mhm.
And I would just add, because I know that you already do this, but I'll add from every step of the way, like the person who answers the phone, the person who greets them when they walk in, like,
Yeah.
it needs to be like kind, caring, soft, safe,
Right. Yeah.
supportive, because we are setting the conditions that are going to be the most conducive for them to be able to go deeply in themselves, in
Absolutely.
order to be able to have an experience, both pharmacological and experiential, that really frame their ability to make lasting changes in their life. I mean,
Yeah. I
that's
think
kind of
that's
how
a
I view it, is that
no, it's a beautiful summary. We talk about kind of preparation, medical session integration, right? Or medicine session integration. And, we talk in our practice, preparation starts the second that person, finds Dérive, so they end up at our website or they end up on our social media or they're hearing about us from their therapist. And that preparation phase is already starting, right? So as you get to know me, when you reach out to our clinic, the tones of our emails, the tones of those phone calls are already starting to kind of let you know who we are. Can you trust us? Can you feel comfortable in us? And the more that we're building that rapport and container and safety for that client, the more the medicine session is going to help them, right? Because they're able to kind of relax and lean into that and learn more about themselves. And then it all kind of just rolls into integration and that kind of process of continuing that care, I think.
right. And so, kind of switching a little bit, and that I would just plug, like, those are skill sets, like learning about what is preparation, learning about how to do a good medicine session, learning about integration. On the physician side, any kind of thoughts about that before we transition into the, like, what is CAP and how do you
Yeah.
integrate CAP into your practice? Like,
Yeah.
again, those are words that we throw around, but, kind of specifically for people that are new to the field, if you're a physician and not a therapist, what do you
Right.
need to know in kind of a nutshell about those pieces, about how to do those effectively?
Yeah. I mean, I think that one way to look at preparation from a physician side is to think about doing like a really, really good informed consent. If someone's about to have a very complex procedure, how would you sit down and talk to them, really hearing about one, how did they end up at this procedure?
Mm,
What's their story of getting here? And then really kind of making sure that they understand and fully know what to expect, in a very, very deep way. And so if you had unlimited time to prepare somebody, for a complex surgical procedure, how would you do that? And so
mm,
I think you could start with some of those tools because you really want them to know exactly what to expect. What is this going to feel like?
mm,
And then I think that this is where experiential training can be really, really helpful because once you've experienced the medicine, it makes it easier in some ways to do this preparation phase because you really kind of know what you're telling the person to prepare for, right?
right. I
And
mean,
that's a
that's
little
the
bit
bait in the
foreign.
field, right?
Yeah.
People
Yeah.
need to have, the medicine, and our whole training program at Living Medicine Institute is really founded on the principle that, like, yes, like
Mhm. Mhm.
definitive yes,
Yeah.
right? It's
I think
really
it's
important to have
extremely
a
important
robust
and it
mindset.
really refines the process, and I think that that's pretty foreign for medical providers. We've talked a lot about this at the retreat that for therapists, they're very used to going through the certain type of therapy that they're learning to give. But, as physicians, like I don't have to have an appendectomy to give an appendectomy or go through chemotherapy to, give chemotherapy. And so that's a pretty foreign concept to us of like, oh, I should experience this, but it really allows you to have a deeper understanding. And maybe a comparison is that in medicine, if you've done 1,000 appendectomies, then yes, you have a really good idea of what to expect and what exactly that looks like.
Yeah,
But it's even faster if you've experienced it, right? That you really
right.
learn what to expect. And I think that that's really important in this therapy of like, you know, if you've experienced, then even better how to prepare the person for what's ahead, for them.
Right. Well, so, and then kind of moving into CAP, ketamine assisted psychotherapy, because
Yeah.
therapists also do preparation, medicine work, and integration. Like in your clinic, do the therapists sit with the client during the whole medicine session, and are they talking much of the time? Because that's another piece in the field that people are like, no, 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 we don't talk during the medicine session. And
Right.
it's not how we do it. We do talk during the medicine session.
Yeah. So there's a huge variety in our office. And so, our general approach is that, we really are trying to do wonderful preparation, telling the client what to expect. And then we encourage a very deep internal experience, truly leaning into that psychedelic experience of ketamine. And so we often do eye shades, noise canceling headphones. And we always schedule so that one of us, either myself, or the provider or the nurse, can be in the room with the person so that we can support them throughout the infusion. And then, we're really on that recovery side. So as the person's starting to come back, as they're starting to kind of come through that psycholytic phase into, kind of true recovery, we really sit with every single person or, starting to process with them of, what their experience was, and maybe helping them start to kind of pull some little tidbits out of like, what can they start to integrate or start to work with, which could be beautiful. But we have several therapists that work with us as well and do actual CAP sessions. And so that is, sitting in with the person with the understanding that there may be some therapy during infusion. And even though almost every single one of our therapists has done training through LMI, we see a significant variety in how that practices and client to client. And so some clients, I think, really have this opening from the medicine and want to kind of explore during the medicine session of, talking and processing as the infusion is going on. And that works great. And then some clients really kind of lean into the psychedelic experience. And then, maybe they'll make one or two notes of, oh, remember to talk about this, or remember this came up. But for the most part, really quiet. And then the therapy is happening really kind of after that infusion, in the hour after, the IV infusion, I think is what we see a lot in our practice.
What would you say about scope of practice? And what I mean by that specifically is you are talking about having your medical team sitting with during the ketamine and doing preparation and integration, and you're referring to that as ketamine care. And then you're also having therapists come in and they are doing their own form of preparation and integration. And there's significant overlap. Like we both training program. And, one of the things we're always like, we don't want medical providers to be thinking that they have the same training as therapists. And yet it's not that they can't care and do good relational work.
Right.
So what are your thoughts on scope of practice with that?
Yeah, I think it's challenging. I think one of the things that's been really interesting from the research on psychedelic therapy is that we see that this patient-directed, patient-centered therapy seems to be really, really effective in this work. And that's certainly what we found in ketamine therapy overall. And I think what's nice about that therapy is that it's something that you can train a lot of people on. You can train a nurse, you can train a physician, I think, to do a lot of that. Because it really is about, again, holding the space for the person, allowing them to explore their thoughts, feelings, emotions deeper, maybe having some keywords and questions that, to ask to kind of guide them through that exploration, and really helping them track, as they're kind of having that self-discovery. And we found that allowing that kind of allows people to dive deeper and take home some messages, right? But I think where you really get into the therapy side is we see this particularly in trauma clients, clients that have had, significant trauma. And it really requires maybe a next level of skill. And we know that, therapists that work in trauma often have very advanced training because of that. We also see a lot of somatic work come up in, ketamine therapy. And people get a lot of feels in their body, a lot of sensations in their body, a lot of, somatic release. And I think those are things that you really have to have specialized skill set to be able to, handle. And so I think that if you're a physician that's like, hey, I want to do some of this, I want to incorporate ketamine plus care or ketamine plus therapy in my practice, that you need to realize that you're probably not fully equipped for that, initially. And so you need to do some deep level training on that, whether it's through an LMI type program, or, CIIS, and going into psychedelic therapy and training, from that side. And there's some great, trainings for that. But I think initially we don't all have that skill set to kind of dive deep with clients. And so it's tough. How do we balance that, right? We know that after an infusion, we need to hold that space for the client. We need to probably give them the room to kind of process and hear what what their experience was like, and kind of set them up for success in processing that. But I think that we also have to realize that, hey, we're not therapists. And so I shouldn't be, deeply diving into their trauma and processing their trauma with them. And part of what we do on intake is we really get a good, feel for what is the person's support outside of Dérive, right? So do they have a therapist? Do they have a psychiatrist? How are they going to process? And so we incorporate that into their care and their journey to make sure that we know where they're landing, after their infusion, right?
Right. Yeah. So sounds like for you, you're not necessarily differentiating too much
Yeah.
between the medical team and the therapy team in terms of it kind of depends on what the client comes in with and what you identify as their needs. Is that accurate?
Yeah, I mean, I think that's true to some point. I think that we've gotten good at identifying people that we know are going to need really deep therapy and making sure that one of our therapists is involved if that's the case. And so, for instance, if someone comes in with complex, PTSD, I'm going to know that they're going to need very deep care from a very skilled clinician, therapist. And so they're someone that I am either setting up directly for CAP with one of the therapists that we know and trust that have therapy experience. Have trauma therapy experience, or I'm making sure that they're seeing someone for integration work between, that is very experienced and knowledgeable. And our team is kind of extra careful, with that client. So I think that we almost kind of triage a little bit, right? If you're someone with treatment-resistant depression that, seems to have a good care team, outside of us, then I think we do a lot of the work ourselves and, feel very comfortable in that and have seen great outcomes. But if you have complex multiple diagnoses, then we kind of build this other team around you, right? To be able to support that even more.
I mean, one of the things I say to people, and I'm curious if you agree with this, is that it's very straightforward when I say it, but you know, the greater the complexity of
Mhm.
somebody's presenting issues, especially when we get into complex trauma and relational trauma and kind of repeated, iterations and repeated cycles of both symptom-based and behavioral manifestations and difficulties in multiple domains, the more complex those presenting issues are, the more beneficial a well-trained therapist is likely to be. I mean,
Absolutely.
do you agree with that? It sounds so simple when I
Yeah.
say it, but like I think it's a really good marker.
No, absolutely. I think, one of the things I heard in a presentation recently that stuck out to me was like, you get this thought that like a therapist has referred someone for ketamine therapy and you're like, oh, this is going to be an easy one. But it's actually like to realize, no, this is a tough one because this is someone that's been seeing a therapist, has had really good care for a couple of years. And the therapist is saying, hey, they need something more, and so it's,
Something's not happening.
right, exactly. Yeah. So it's interesting to, I think, yeah, to be able to get really good at that triage of realizing, hey, what does this person need to fully complete this container of care for them?
So, what makes a good ketamine clinician? And that might be CAP, right? On the
Mhm.
therapy side, it might be a medical provider, but you've been at this for a while now. What are you looking for in team members? What do you think? What do you want to impart to the world? Like, what makes somebody good at this work? And then, what's the role of training in that?
Yeah. I think ketamine work as a provider, as a physician, is very very challenging
Mm,
because you have to be able to do a couple things really really well. Like you have to be a really good physician, and so you have to be able to like safely take care of someone, right? And so, that is this kind of medical side of the container, right? Like how do I mix a ketamine infusion? How do I infuse it? How do I monitor vital signs during that?
mm.
Paying attention to
Dosing
the research,
protocols, learning dosing
right?
is important. Yeah.
Yeah, strict protocols and, really sticking to your dosing protocol, not adding other medications. And so kind of, this following the literature and staying up to date on the literature side of it, I think is really, really important. And then you also have to learn all this other side of like, well, how do I, prepare somebody for this? What does the room need to look like? What kind of supplemental items do we need in the room for music? What kind of music do we play? And so, I think that I think one is just going into this is that you have to be committed to that, right? Like I know I'm going to hold and balance these two things for people that I'm going to take really, really good medical care of them, but I'm also going to realize that there's this psychiatric and psychological component to this that I have to be very respectful of and learn and care for. And so, you have to kind of see where your weak spots in that and where your blind spots in that. And I think a lot of that is where training comes in, right? To say, hey, I'm going to go get some ketamine specific and psychedelic specific training, so that I can, learn more of that side. Like you may be a great clinician that's worked with ketamine in many, many different ways, but how do you work with it in this way? And that requires some kind of specialized, training and learning, I think.
Right. And one of the things that we try to do is to really bridge the conceptual with the applied.
Hmm.
So, there's the learning about the field, there's the learning, which is all important and great and
Absolutely.
wonderful. Like, what is psychedelic assisted psychotherapy? What are the histories? What are the origins? What's the research say? But then there's the how to, right?
Yeah.
Like day to day, how do you actually work with the medicine, which I think is
Right.
really sometimes overlooked.
Yeah, absolutely. And I think, doing a training, but then also, finding places that really seem to be doing it well, whether that's reaching out to, people like us that have been through a lot of training and a lot of experience and kind of saying, hey, who can I go visit or go learn about this from? But really seeing how this works and how it happens and what the work actually looks like before you jump into it. Because I think just as physicians, we have this tendency to really say, oh, this is a medical procedure. I'm going to give somebody ketamine.
I know about a medical procedure.
Right. Yeah. I know how to give someone, a ketamine infusion. It's easy.
I've used
but there's just so much more. Right. There's so much more to it, to ketamine therapy. There really is a lot to it,
Yeah. No, we're good. I love that you're saying that. So, I want to ask you real quick, kind of, you recently went to a conference. So, what are some of the important findings? I mean, one of the things, and then just kind of, what else kind of does the field need to know? I mean, one of the things I really respect about you and really have from the beginning is it really does seem like you really stay on top of the literature and stay on top of the science and are really following these trends, these in the field about, ketamine care versus ketamine alone. And I know you just went to that conference and just, there was some data that you shared with us. So, can you speak to that or anything else that
absolutely
learned?
Yeah. So, I mean, I got a great view into the two silos recently of like psychedelic medicine and ketamine medicine. In that November, I went to the annual conference on psychedelic therapy that's put on by Mass General up in Boston. Okay. And then just last weekend, I went to the ASKP3, which is the American Society for Ketamine Providers, Practitioners. And that was in Austin, Texas. And so, you go to the psychedelic conference and it's really all about, this research on psilocybin and MDMA. And, there's some beautiful research on what kind of therapy do we do around this and, how do we hold this space for clients and seeing how people get better. But there was very little talk about ketamine and how to work with ketamine, right? Yeah. And so then I go to this ketamine conference and I think that the ketamine conference has come a long way in the last few years. If you went to one 3 years ago, it was very, very scientific and, was just very much about, what we talked about, this sterile idea of like you give people ketamine and they get better. And so I like that the second lecture of the day was really about, it was called Dissociating with Ketamine. And it was about, really therapy around ketamine and how do we deal with the psychedelic experience that happens and how do we support people through that, and then what kind of therapy works well with ketamine. And it was put on by a PhD level therapist, and that was beautiful to see that kind of so high up in the almost a headliner, right, in that work. And so I think that everybody's kind of starting to wake up, and the real takeaway that they actually said at the end of the conference is that what we're doing is not ketamine, we're doing ketamine plus care. And I loved that thought process. And I think it's going to be a really important part of ketamine work moving forward, is that we have to really figure out how do we create this beautiful container for people that's focused on healing and transformation. And
well,
that
and
it's more than just infusion.
I think that's going to avoid those, or at least minimize the likelihood that these adverse psychological events that, the way ketamine is showing up in ERs is psychological events, right, like panic attacks and things like that. It's not. And then that doesn't even talk about the people who are too ashamed to go in. I was supposed to have this amazing experience and now I've been wounded by it. And again, it's not likely to be the physical. It's likely the psychological, and we have control over that.
Absolutely. Yeah. And learning those skills to be able to support someone through a challenging experience and actually, help them find light and brightness and transformation in that it's a difficult skill, but if you can learn it, you can be an amazing part of this care,
Yeah. So kind of last little segment, what do you think the field needs? And what would you like to share? Like you're in it, you're doing both those tracks, the psychedelic therapy and the ketamine care and the medical side. And, what does the field need? And what do you want to share? What do you think is important for people to know?
Yeah, I think my big takeaway, from both these conferences and kind of where I'm at right now is just realizing that, we are the founders in this field. This is so early on, 2016, 2017. Right?
I talk about it all day, every day. I'm like, everybody doesn't do this.
Yeah. We're like, oh yeah, ketamine therapy, yeah, that's what everybody does. But, to realize that it's just 2016, 2017 were the first clinics that were doing this.
Yeah.
And, you go to the national conference on ketamine and there's like 500 people that are members of this, and so we're kind of like the founding, fathers and mothers of this. And so it's like to realize the responsibility of that is, I think, huge, and so but it also opens us up to say, yeah, there's a lot of responsibility, but we also have this opportunity to bring this all together to say, hey, what's working in psychedelic therapy? And yes, ketamine can be used as a psychedelic. And yes, ketamine is very safe. And we have some great research on ketamine. So, it's exciting to me. How do we bring that all together and work with this amazing medicine to transform people's lives and, to kind of, I guess, spread the word on that so that we can kind of set these standards of like, hey, this is how you work with this medicine and how people get better and have lifelong transformation from it,
Well, I love your commitment to it. It sounds like it's been a real positive journey for you. I mean, would you say
Absolutely,
that?
Yeah, absolutely. I mean, it's, I say I've done really cool stuff in the emergency department, right? Like, just things that have changed people's lives. So this is the coolest thing I've ever done in medicine. It's just amazing to kind of watch people transform in front of your eyes, as you do this work and care for them. So
I love that. Well, I really appreciate you, and I'm honored to know you, and I appreciate your time on this. And, thank you so much for sharing your wisdom and your expertise. For those who are interested, they can find you how?
Yeah, so Derive, it's Derive Health, but spelled like derivehealth.com.
Uh-huh.
And you can go there, and you can also reach out to me at Jonathan at derivehealth.com as well. It's JONATHAN. I'd love to hear from you and connect. But thank you for all the work you guys are doing. This is amazing to be a part of, and I really appreciate you guys having me on.
Well, thank you. All right. Bye, everybody. We'll look forward to seeing you again next time.
Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.